I thought this was pretty common knowledge at this point. Apparently not. See, the only thing that will stop the virus entirely will be a vaccine. And if people keep taking vaguely worded health advice from a roadside billboard, I really hope that we approve one fast. Now, in the meantime, wear a mask, follow the restrictions that go into effect tomorrow in Oregon, and the ones that went into place last night in Washington. Now, look, just because I say all that doesn't mean that I stop doing my job as a professional question asker. I mean, one of the big restrictions that people seem to be honing in on here is not being able to dine in at restaurants or drink inside bars. And for good reason, because that's been a huge hit to our economy once, it's about to be again, and people are losing their livelihoods. But we also know that doctors are seeing most of these cases of COVID-19 spread during social gatherings at people's homes, hence all the talk about Thanksgiving, but not really at restaurants. So by that logic, it kind of makes sense to limit the number of people that you can have over, but why close restaurants, especially considering the devastating impact it's having on our economy? I had a chance to ask that question to Dr. Paul Cieslak at the Oregon Health Authority. Here's what he said.
Why were restaurants closed and other places not?
Right. Again, that's a reasonable question. And I will say that we don't have great data in Oregon on just where people are getting infected. The fact that a certain percentage of people say that they haven't been exposed to, haven't been outdoors, haven't been away from the family much, makes us infer that a lot of the transmission is going on in households. That said, we know that large aggregations of people crowded in indoor spaces is the way to facilitate transmission of this virus. And there are compelling data from other states and nationally that have suggested that restaurants in particular are a problem. And so when we think about, what actions can the state take to reduce transmission, restaurants, bars, places like that rise to the top of the list.
So basically, it comes down to this. It's a lot harder to control people's behavior in their homes. It's kind of down to the honor system, really, but not in the case of restaurants, which they can actually go in and change things around because they have state licenses. He also had this interesting reason for Oregon's poor testing rate compared to other states.
We were kind of a low priority for the federal government to get testing supplies because we've been so successful or lucky in terms of our disease rates. So we've had lower disease rates than most of the country, and so we were not first in line to get a lot of testing supplies. One thing that should reassure Oregonians about the testing, though, is that when you look at what percent of Oregonians are positive on their tests, we've had lower percentages than most of the country, which means that we're testing just as many as or more people in order to find one case of disease in Oregon as they are in other places.
But if our success as a community kind of combating this virus compared to other states has put us lower on the government's priority list, the federal government, when it comes to testing, will that also put us lower on the priority list when it comes to widespread vaccination?
I don't think so. I think the vaccine is pretty much being distributed on a per capita level, but we don't know the exact numbers of vaccine that we're going to get yet.
All right, so once again, Oregon's 2-week statewide freeze goes into effect tomorrow. That means no more than 6 people in your home, and not for more than 2 different households. No eating at restaurants or drinking at bars, no working out at gyms. For the rest of the restrictions, and there are more, you can check them out at kgw.com. There are quite a few of them. Now remember, for Multnomah County, it is 4 weeks, not just 2, and that's going to seem like a really long time, but I don't know, think of it this way. It's also the amount of time that we have to wait for a vaccine to start being administered at, the earliest goalpost that we can see. It's probably going to take longer, most likely. Definitely longer for some of us who aren't in those high-risk categories. But we are at the point in this fight against COVID that we are having realistic and optimistic discussions about vaccines, and ones that have proven so far to be pretty good with 90% effectiveness. I would say that's progress, and it's worth waiting a month at this point in the safety of your home, even over the holidays.